Thanks, Team GS1 Canada, for coming here together today. Warm welcome to our colleagues in Montreal because they're gathering together at the I&B office.
When you go back a little bit, we know that barcodes, linear barcodes, have been around for 51 years, right? So we all know that. In 2000, so 25 years ago, the Canadian government gave us some funding to create CCNet, which was our first registry.
You know, what excites me, it's really that ability to link what we do to patients, right to that end user. There really is so much opportunity and it's right there for us to take. And so when you think of healthcare, you know, a 2D identifier is much more than just something you put on a vial of medicine or a device and goes to efficiency. It really provides a benefit that's much more than that. It's about reducing risk. It's about helping patients, saving lives in some cases. So
not only am I passionate about healthcare, but I was the advocate for both of my parents when they were palliative and then they passed. And my mother didn't die because of a medical error, but a medical error made her very uncomfortable in the last couple of months of her life, and so became a real strong advocate for patient safety.
None of us want to see someone injured or die because they scanned the wrong thing or gave the wrong drug, which happens daily. And that's because we have not implemented global standards.
You know, all of those things leverage the GS1 standards to reduce medication errors and ultimately, improve the administration process and unit dose packaging. You know, how does our organization benefit? Well, adopting foundational standards is really important because having a single source of the truth, information that's reliable, and what GS1 does, it gives us standards. It gives us a third-party reference point with the ECCNet data that we're now able to use and test our data against.
Thank you once again for taking the time to celebrate 20 years of GS1 Global Standards in Healthcare. You guys are amazing.
Hi, I'm Anjan, Senior Director of the Public Affairs team here at GS1 Canada. Is something as simple as a scan can help identify drug shortages and help governments. It can help relieve healthcare workers that are tired and can focus on what they actually like to do instead of relabeling products. We can actually get products tracked and traced from all around the world and right into the patient record. That's empowerment, and that's what's going to make the next 20 years even more exciting, and I look forward to it.
I'm Jason Laxdell, Vice President of Industry Managed Solutions. Safer care really is about patient safety. It's about reducing the risks to those we love in the healthcare environment because of human error. Mistakes happen, but when healthcare professionals harness the power of advanced GS1 standards like the 2D barcode, a simple scan at the right time can reduce or eliminate those mistakes.
Hi, Debbie Atala, Senior Vice President of Global Standards here at GS1 Canada. I'm looking forward to the opportunity when healthcare, nurses, doctors use that barcode to ensure a simple scan ensures safety of all patients in Canada and worldwide. Very excited. It enables people to really advance, have the people do the things that people need to do, and use the barcodes to do the administration that people don't need to do. Very, very forward thinking, and I can't wait for the future.
My name is Bouchard. I'm the Vice President of Community Engagement and Partnership. What Smarter Scan means for me is patient safety. Each patient should have the ability to have the right medication either at their bed or in clinic. So very important to have traceability of all the medication.
Hi, Melanie I'm Senior Director on the Healthcare team. So what it means to me is actually speaking the same language. Que ce soit en français, que ce soit en anglais, on se comprend tous, et on peut tous, dans le fond, serrer nos amours un petit peu plus.